Hey everybody, it's Matt Shu with Josh Hash here at Upright Health, and today we're going to show you an exercise that you can do to help with kyphosis in your thoracic spine. So we get emails from people who have seen a previous video on the Upright Health channel that talks about how to deal with kyphosis, and some of the older viewers have actually said, that's a little too aggressive, I can't comfortably do that. Is there another way to get the thoracic spine to straighten out? And the answer is yes, there is. So we're going to go through that exercise with you today.
All right, so let's get started with the exercise. Now, as you can see, this exercise is really complicated. Okay, all right, actually, just kidding. We're going to get started with doing our thoracic extension exercise to fight this kyphosis. And Matt's taking a little nap here on the ball. He's still a little jet lagged.
Little jet lagged from the last trip. Little jet lagged.
But we're going to get through it. So what we're going to use here is we have a nice big cushiony medicine ball. You can use any type of ball that will be somewhere around this size.
Yeah,
okay,
so it's like a foot, maybe 15 inches off the ground, maybe.
Smaller is fine, but just as long as you can do this exercise that we're going to show you here. So as you can see, Matt's kind of sitting down. He's going to start in a quadruped position, then sit his hips back to kind of this like frog type position, right? And what's important is that we want to have the back flat to start here, okay? We don't want to be overextended or rounded in this lower back, okay? We want to have a flat lower back. Now from here, what Matt is going to do is he's going to simply let his chest, kind of the sternum area, fall down to the ball, okay? Now, you can kind of play around with what area the ball is actually touching on you, but we'd probably suggest somewhere from the chest down to the upper abdomen area, okay? Now, from here, we're in the position to then do this exercise. So from here, what Matt can do is he's just simply going to lift up with keeping contact with the ball here. Now what you can see is now he's getting some extension from this upper back area, okay? So go ahead and go down, Matt, and let's show again. So that, as you can see, he has a little bit more flexion rounding here. Now as he comes up, we get more straight extension from the upper back, okay? Now we're going to show you a couple ways that you can maybe do this wrong. So before you even try it, you'll know don't do this, okay? So if Matt brings the ball too high, he's kind of up here on his neck area.
Not only does this crush your microphone, but you also don't get the benefit of the exercise.
So as you can see, like Matt's really not getting any extension from here. He's more just working his neck at this point, right? And that's definitely not what we want to see, okay? Now if he brings the ball too low, what can sometimes happen is now he's kind of getting some extension from his lower back, okay? And we don't want extension from here. We're working on getting extension from the upper back area, okay? And now another mistake you can make is just, bringing your chest up off the ball, okay? The chest needs to stay on the ball the whole time. That's the point of the exercise. If we're coming up, now Matt's doing a kind of a frog push-up here with lower back extension, right?
Trying to make my money.
We don't want to see that. Okay, so
Some
we'll go
people
back
want to see
to
that. Some people want to see that.
leave that to your wife, all right? So let's get back to the correct position here. Now we'll give some guidelines for doing this exercise. So as Matt comes up, what we're going to recommend is that he probably starts off by holding this position for, if you're a total beginner, then probably somewhere around 30 seconds, okay? 30 seconds to a minute, and if you're really a strong warrior man, then you can hold it longer than that, and that's fine, okay?
Strong warrior man.
Strong warrior man. Women too can hold it that long as well. And then another option of what you can do is we can just do more of a repetition like this, right? So Matt's going down, and then he's extending back up, okay? And now this is, because this exercise is pretty low intensity, we can do this for, somewhere from 10 to 20 reps. You can get a little bit higher in there, and you won't be at risk of harming yourself too much, okay? Any other recommendations, Matt?
No, just be conservative about it. Just make sure also that you're doing it right. If you can have a mirror to the side, or if you can video yourself just to check what your spine is doing, that's pretty helpful. It's pretty easy to compensate with the wrong musculature in your spine, so having outside eyes to check it would be great. Otherwise, use your camera and check it yourself. Otherwise, yeah, I think that's pretty good.
Yeah, sure. And try this out, guys. We've had a lot of success using this with some clients here at Upright Health, and especially people that are at a desk a lot of the day or sitting down that are kind of get into that rounded hunchback position. This really helps with reversing that, okay? So if you do find that this is giving you some benefit, then do it multiple times a day, right? Put this into your routine and make sure that you're using this as a staple.
Yeah, I just want to mention to close that right now I can feel my spinal erectors working a lot. They're kind of burning now. I can feel those muscles really kicking in. So it's definitely an effective way to do it. It's not a lot of pressure. It's not uncomfortable. There's nothing about it that makes it too challenging. If you need a pad for your knees, I do want to mention that. Put a pad or a yoga mat or something under your knees so that your knees don't become the limiter for the exercise. So, yeah.
Cool. You heard it here first. Try it out, guys. Remember that pain sucks.
Life shouldn't.